Hi everybody, welcome back to the channel. It's Dr. Singh, your specialist doctor here, and today I'm going to be telling you a little bit more about how the medical cannabis plant itself actually works. So before we did touch on that there are over 450 different compounds plus within the cannabis plant, and of those about 80 of those are known as cannabinoids. So let's have a little bit further look into those. Now we know that the most commonest cannabinoids that people know about are the THC, which is the active component that causes the psychoactive symptoms that patients are reported to get, and that's one of the most commonest things that people know about. Then the other most commonest type is known as CBD, that people use as oils or other types of extracts to use on the body that they can get from over the counter. Then you have others known as CBN, CBL, CBC, CBG, and these ones don't have those psychotropic types of effects, but they work really well on other parts of the body, working in such a way to act on pain as well as inflammation. These different types of cannabinoids work on different receptors throughout the body known as CB1 and CB2 receptors. The CB1 receptors are mostly located within the brain, whereas the CB2 receptors are located in the periphery, known as the other parts of the body outside of the brain, and that's why they work on pain and inflammation at those sites. There are different strains of the cannabis plant, and they work in different ways because they have different amounts, not just of the THC or the other types of cannabinoids that we just spoke about, but because there's something called terpenes. And that's something that doesn't get spoken about a lot. So let's have a look at those terpenes because they are massively important. Now when we say the word terpenes, a lot of people tend to get confused and they've never heard of this word before. But if I told you they were commonly found in fruits, herbs and plants, this might start to ring some bells of what you may have already heard about before. Where you find terpenes, they actually give the scent, the aroma, certain taste, as well as unique properties that are related to anti-inflammatory, pain, antioxidant, sometimes even anti-tumor factors, lowering blood pressure. All these different types of things and more is related to the terpenes. What the terpenes do is they have a synergistic effect. This is also known as the entourage effect. What that means is they work with the other cannabinoids in the plant to work together to give the effect that is desired. And that is why having the correct type of terpene in the specific amounts with the other types of cannabinoids is how you get the different effects within the cannabis plant, and that's why it can be tailored towards different conditions that have different symptoms. So if somebody is having a lot of pain, you want to target the pain with the certain types of cannabinoids as well as the certain types of terpenes that work in that direction, whereas if it's for inflammation, you want the anti-inflammatory components. If it's for things for mood and anxiety, you want those terpenes that work in that direction, and so forth. So there are over 200 different types of terpenes that are known at the moment, so let's have a look at some of them. Some of the most abundant terpenes are known as Myrcene, Limonene, Caryophyllene, Pinene, Linalool, and there are many others. Let's take a deeper dive into some of those and the effects that they have, and some of these are actually going to be mind-blowing and eye-opening. So let's have a look at limonene. It's one of the most dominant types of terpenes out there. It can be found in lemons, grapefruits, oranges, limes, as well as other different types of fruits. It is well known for having energizing as well as anti-inflammatory properties, and that is why it can be used as an antidepressant as well as an anti-inflammatory agent. Some of the other research done around this has shown that the plant can actually be used for antioxidant effect, anti-cancer effect, cholesterol reduction, appetite and weight loss. And that's on top of the anti-anxiety, anti-depression and anti-inflammatory effects that we've mentioned. The next one is myrcene. This terpene has a sedative effect, but it's dose dependent. So actually in the much lower doses it gives energy, and at the higher doses it actually makes the body feel much more relaxed. The other thing that myrcene does is that it enhances the THC activity by helping it cross what is known as the blood-brain barrier. Therefore it increases that psychoactive potency that THC has. The benefits of myrcene are that not only does it act as a painkiller known as an analgesic, but it also acts as a relaxant through its sedative effects, so it can help with things like people who have problems to do with sleep. This terpene can be commonly found in beer, lemongrass, mangoes, and parsley. So the different types of conditions that can be used for are helping with sleep, helping with pain, acting as a muscle relaxant, also working as an anti-inflammatory agent, and some of the other benefits that are reported by research are the antioxidant, anti-tumor, as well as anti-aging effects. That's pretty impressive, so let's take a look at pinene, which is the next terpene. Now, pinene is normally commonly found in pine trees. It's very abundant in nature. It essentially exerts a calming, anti-inflammatory, as well as, interestingly enough, what we call a bronchodilator effect. This means it opens up the airways within the lungs. Interestingly enough, study was done on this terpene, and it showed that if it's applied on the skin, it can protect against UV damage. You can find it in sage and rosemary. So the benefits again are anti-inflammatory, pain relief, stress relief, therefore helping tackle conditions like depression and anxiety, and potentially, as mentioned, even helping open up the lungs more by that bronchodilator effect. Let's take a closer look at caryophyllene. Caryophyllene is known to give that spicy hint to black pepper, and you can also find it in cloves, hops, and rosemary. And interestingly enough, it's the only terpene that's known to bind onto the endocannabinoid receptors within the body. It directly binds to the CB2 receptors, the same as how CBN binds, as well as THC through the immune system. And that's why it's shown to have an anti-inflammatory and anti-pain effect. And that's why it can be used in those types of conditions. It's also known to have a very calming and soothing release, and that is why it can be used as a stress relief, and hence tackle anxiety. Other places where it can be found are in lavender and cinnamon. So let's have a look at humulene. It is actually one of the terpenes in the plant that actually deters pests, as well as fungal infections in the plant's life cycle, and therefore acts as a protective mechanism, keeping it safe from those things. And therefore that's why the research shows that it has anti-inflammatory, anti-cancer type of effects, on top of antibacterial and wound healing properties. It can also be used to suppress appetite and also aid digestion, helping patients lose weight. This in nature can be found in pine trees, sunflower, as well as black pepper. The next one is linalool, which has been shown to have antimicrobial properties to help protect the plant against other diseases, and therefore that translates into humans as having therapeutic uses such as for antibiotics, traditional medicines, as well as sedatives. It essentially produces a very relaxing and soothing effect, and that's why it can help patients actually have much better improved sleep and therefore tackle the condition known as insomnia. But research has also been done on this to show that it has pain relieving qualities because it targets what is known as the acetylcholine system in the body, essentially reducing the excitability of the spinal cord, which reduces the transmission of the pain signal and increases the adenosine levels within the brain, which then also reduces the heart rate. Regarding epilepsy, it blocks the glutamate receptors, potentially showing that it could help in epilepsy, reducing the seizures. Studies have also shown that linalool can help in Alzheimer's disease by reducing the plaques that cause the disease in itself. Linalool can also be found in lavender, cinnamon, as well as birch bark. And that just covers a few of the terpenes. There are so many others that have different effects, but these are some of the commonest ones. And just to show you, they have all those different types of properties. So to finish off with, we can just cover, you get anti-anxiety effects, antidepressant effects, you get the anti-inflammatory, the pain relieving qualities, the ability to help with sedation, to help with problem with patients when they have sleep troubles, amongst a whole host of other different features. And therefore the different amounts of terpenes in the plant, depending on their concentration, can affect the strain to give the different types of outcomes that you're looking for. So if you are someone who is having features to do with anxiety, you would want to have the terpenes in there to the higher degree, which work as anxiolytics. And if you're someone who's got a chronic pain type of condition and you want to reduce the amount of discomfort that you have, then you would obviously want to have the type of strain that has much more terpenes to a higher degree that tackle pain. Well, I hope that was enjoyable. My name is Dr. Singh. I'm your specialist here. I want you to like, share and subscribe to help grow this channel so that everybody can benefit from that. So I hope you enjoyed it. Stay tuned for my next video. Make sure you stay blessed. Thanks for watching.